So how can a neurological model of assessment and treatment work to combat pain, movement dysfunction, or even fatigue? And what is the process by which we go about that? So one of the amazing benefits of what we do here is that every possible combination of contributing factors is taken into account. So instead of offering simple soft tissue work or ultrasound or exercises for a number of sessions and running out of ideas, we're able to look at the body as a whole and how this whole could be affected by the tiniest piece of negative feedback from the brain via proprioceptive pathways. The largest part of the process of treatment here focuses on identifying each and every single important contributing factor towards any symptom you may be experiencing. More often than not, there are multiple contributing factors that play a role in any given symptom. Some create stronger expressions of the symptoms, others less so, but they all contribute towards that symptom. So an example of this would be someone who has IBS. Quite often there will be a plethora of foods or drink that will trigger the symptoms of the irritable bowel. Some will create more extreme symptoms than others, but they all contribute. So our model of treatment here aims to identify and treat each one of these. So there's a contributing factor, there's a contributing factor, we've got a symptom. All of these will contribute towards a symptom. Some will play a bigger role than others. So our model here, we treat these methodically and accurately, removing the brain's perception that a stretch to ligament X, which is maybe one contributing factor, or an area of nociceptors, which are receptors, nerve-ending receptors in the skin that perceive, that send information to the brain that may be perceived as dangerous, or areas of the body that should be avoided. We treat and intervene on those and how the body perceives and processes that information. So eventually, and sometimes this eventually is much sooner than later, we remove enough of these contributing factors, the pain and the symptoms desist. Sounds fairly simple. In essence it is, but this is why every experience you have and have ever had, and every movement and thought that you make and do on a daily basis can contribute. It's a complex model of assessment, but one that never runs out of ideas. One of the many benefits of what we do here.